Your recent publication bridges social policy, gerontology, and poverty research. Could you explain how the concept of care poverty fits into this interdisciplinary framework and what led you to explore this intersection? I've been involved in research on care for older people for quite a long time already, and I've been missing a closer connection between social policy research and gerontology. Social policy often focuses on structures, systems, care workers' conditions, also informal carers, but it doesn't speak much about older people, their positions, their needs. While gerontology often looks particularly at older people, but then it doesn't include a discussion of social structures or policies. And finally, I have also been reading poverty research and been quite inspired by its conceptual frameworks and also methodological toolkits, as I see that there could be a lot that we could learn from poverty research and use that in care research. Not directly, but apply a number of its concepts and approaches. In your work, you highlight the care poverty approach as a means to analyze unmet needs as a form of social inequality. Can you provide examples or insights into how this approach sheds light on the unmet needs, care needs experienced by individuals and communities? The key argument or approach of my research is that the lack of adequate care should and could be seen as a kind of social inequality in itself. By saying that, I would like to emphasize that just like any other area of inequality, whether a person receives adequate help and support divides people into two groups: those who have what it's needed and those who don't. And this is really a key issue. It's about a basic need, and it makes a big difference whether people can have their needs met or not. When we make this discussion or this observation, then we can also analyze this care poverty as a kind of as a type of social inequality in relation to other dimensions of social inequality, like gender inequalities, inequalities between different ethnic groups, regional inequalities, and so forth. And this brings a new perspective for the research on care and care inequalities. One unique aspect of your research is its focus not only on formal care but also on informal care. Could you elaborate on the significance of considering informal care within the care poverty framework? A key part of the care poverty framework is that it includes both formal care and informal care. So it's not only about the lack of formal care services. The idea is that we need to always look at both at the same time. It is possible that even if people don't receive formal services, they might receive the care that they need from their social networks and particularly their families, and vice versa as well. So there is a possibility to compensate the problems of one sector with provisions and help and support from the other sector. And if we don't look at them at the same time, we don't get the full picture and don't understand the full situation. And then it's also important to notice that the needs of older people with care needs and the needs of their family carers are connected. So if the older person is in care poverty and has unmet needs, that will have also major consequences for the quality of life and even health of the family carer. on focusing on this issue, we can see this relationship and also the mutual connections in this respect. Could you share findings or observations from your research that illustrate how care poverty manifests differently in various socio-cultural contexts? What are some common themes and where do you see variations? Care systems and care provisions always depend very much on the context, on the national context, on local context, on the care regime. In certain contexts, formal care provisions are a key part of care and support that older people can expect to receive. In other contexts, they play only a minor role. In some contexts, NGOs and other organizations are important partners. In some other contexts, they are not. In any case, in all contexts, the key question is that do older people who need help and support, do they receive that adequately? This is the same question in any context, in any national context, in any local context. But of course, when we look for answers to this question, then we need to be sensitive to the local and national context and understand what can be done and what can be expected and what can be changed in that particular context. In your opinion, what are the key policy implications of adopting a care poverty perspective? How can policymakers use this approach to address unmet care needs and reduce social inequalities in care provision? The care poverty approach emphasizes that we as researchers and policymakers should attach the attention primarily to outcomes. Usually when looking at policy, we pay much more attention to resources, how much resources are used, what are the expenditures of services, and also to how many people are using the services. But very rarely the emphasis and the attention is on what is actually reached with these services and with these resources. The care poverty perspective highlights that we should really ask whether in the end people who have care needs receive adequate care and support or not. This is the key question that both research and policy should focus on. Other questions follow from that, but first we need to see that whether the existing services, existing provisions, together with informal care, are enough to cover the needs of older people or not. Your research has the potential to inform not only academia, but also policy and advocacy efforts. How can organizations and individuals outside of academia apply the principles of the care poverty approach in practical ways to improve access to care services? The care poverty approach is planned and hoped as a general perspective that can influence how people and organizations understand the challenges in providing proper and adequate care for older people. And if the focus is on the outcomes and on whether people really receive the care and support that they need, both in quantity and quality, then all organizations should focus their efforts in order to promote this goal, that people who have care needs receive the help and support they need. And of course, all organizations and also individuals who are working in the area of care and support in different local and national or international contexts, they can have a major part and a major contribution in promoting this general goal. NGOs play a major role in promoting the interests of their members and their users. They also provide many services. Different local organizations can have an important role, and of course international organizations are in very powerful position to promote an agenda that is focused on providing adequate care and enough support for all the people. Could you discuss any innovative or promising initiatives that you have come across in your research that have effectively addressed care poverty and its consequences? Well, there are a lot of policies, a lot of services, a lot of organizations that are addressing all the people's needs and doing their best to cover those needs, or at least bring attention to these needs and the need to have these needs covered in an adequate way. There are many voluntary organizations are playing a major part in this. For example, providing social and emotional support for all the people. That is also an important domain or area of care poverty and care needs. Then there are many specific services. For example, in Finland, I know that there is several NGOs are doing what they call outreach work among older people. They are trying to reach those people who are dropping out of services, who are socially excluded, not only in old age, but through their lives in many ways, and who needs specific support and help. There are also many different services also provided by the public sector that are reaching out and trying to find out needs older people have. This kind of preventive home visits that, for example, Denmark has developed are also one important way to find out the needs of older people and to help in providing adequate help and support for them. Finally, what advice would you give to researchers, policymakers and advocates who are interested in incorporating the care poverty perspective into their work, especially in regions where this concept may be less familiar? At first, I would like to suggest people to take a look on my book that I wrote about the care poverty approach, because that is freely available on the internet as an open access book. And when reading that, to think how the ideas, the concepts, the suggestions that are provided in that book, how they fit in your work, in your context, in your activities that you are doing, whether you come from the policy world or from research or from some NGOs or whatever is the area where you are working. But if you are working in order to provide care for older people or support those provisions, whether it's family care, informal family care, public care services, private for-profit or non-profit services, I think there is space for thinking again how that could focus more on really aiming to cover the needs of older people and different kinds of needs. As the care poverty approach shows, there are these personal care needs, practical care needs, social emotional care needs, among others that need attention and coverage. Of course, the measures and the ways to cover these needs must be different in different local and national contexts, and also the emphasis for different organizations or groups are different depending on where you're coming from and what are your main areas of your work. But I still think that if you are linked and your organization is linked to care for older people, there is something in the care poverty approach that can bring something new and contribute to the thinking, the goals, and also the activities of your organization.